2017, the approval of the first extended-release buprenorphine formulation, Sublocade, brought a much-needed tool to the MOUD toolbox. This was followed shortly thereafter by a second formulation, CAM 2038, also known as Brixadi, in 2023. These two new options have truly been game changers in the management of OUD, but the logistics of how, when, and where to administer them has been anything but cut and dry. In this mini video, we'll go through some of the nuts and bolts of how to bring XR-Bup into your practice. Let's start with the case. Lara is a 38-year-old woman with severe OUD on sublingual buprenorphine who misses her Friday afternoon appointment with you for the third time in a row. In truth, she has been really quite erratic in these past few months, missing appointments and then showing up to clinic when she doesn't have an appointment, stating she's out of buprenorphine and needs a refill ASAP. When she does come in, her urine toxicology screens do consistently show expected buprenorphine and norbuprenorphine levels, but her chaotic lifestyle, transportation challenges, and ongoing intermittent fentanyl use make you anxious and uncertain about how best to manage her OUD. And now at 4:48 p.m., just as you were planning on heading out for the weekend, a message comes in from Lara saying her ride fell through and she needs a refill of her buprenorphine for the weekend. Sound familiar? In this mini video, we'll discuss why extended release buprenorphine might be ideal for Lara. We'll talk about which XR-Bup option may be the best choice for her, how to procure it, how to store it, finally, how to administer it. Let's get started. Lara is in fact an ideal person for the use of extended release buprenorphine. She's erratic about her use of sublingual buprenorphine, and she's still intermittently using fentanyl. She's also frequently calling for urgent refills after repeated missed appointments. While you might be inclined to refer her to a methadone maintenance program, which would be completely reasonable, a once-monthly dose of XR-Bup can also keep her safe from overdose for 30 days or more, while mitigating those buprenorphine refill emergencies and hopefully reducing at least some of that chaos that's in her daily life. While Lara may be the perfect candidate, really any patient with OUD is a candidate for XR-Bup, whether your patient has long-term stability, challenges with frequently lost or stolen buprenorphine films, provider concerns about diversion, or even if your patient is just hoping to find an easy way to taper off of buprenorphine after a long period of stability. In my personal practice, I consider extended release buprenorphine an option that I offer to all of my patients with OUD, leaving it up to them to decide if it's the right choice for them or not. Let's take a closer look at the specific XR-Bup options available. Sublocade, again, available since 2017, comes in two monthly dose formulations, the 100 milligram variety and 300 milligrams. The standard regimen is two 300 milligram loading doses, spaced out by a month, followed by 100 milligram monthly maintenance doses. Though patients with higher opioid use patterns, and again, our fentanyl era, may benefit from 300 milligram maintenance dosing. Brixadi, in contrast, has both weekly and monthly dosing options, including 8 milligrams, 16, 24, and 32 for weekly, and 64, 96, and 128 milligram options for monthly dosing. While these additional dosing options do provide some degree of flexibility in selecting the right dose for your patient, there is some evidence that maximum dose Brixadi doesn't yield quite the same serum buprenorphine level as 300 milligram maintenance doses of Sublocade. So just bear that in mind when presenting these options to your patients. In contrast, a potential advantage of Brixadi, specifically the weekly doses, is that they seem to have a slower rate of rise in serum buprenorphine levels after the dose, which makes a weekly Brixadi dose a useful strategy for performing low-dose inductions. Okay, you've discussed your concerns with Lara, and she is actually 100% on board with trying XR-Bup. She likes the fact that even if she misses an appointment, she won't go into opioid withdrawal over the weekend. and thus she'd have the luxury of time to wait until the following week to get her next shot. So, how do we get it? While XR-Bup formulations are by no means cheap, Medicaid programs in many states now fully cover XR-Bup or offer it with a small copay. For private insurance plans, the manufacturers of Sublocade and Brixadi both offer copay savings programs that are readily found on their respective websites. Assuming cost won't be an issue, let's talk about how to actually get it into your office. I'm afraid it's not as easy as sending a prescription for a Z-Pak to your local pharmacy. This is because XR-Bup is a medication that falls under an FDA-mandated Risk Evaluation and Mitigation Strategy, or REMS, requiring that it be dispensed directly to the healthcare setting in which it's going to be administered and only from certified specialty pharmacies. So this leaves us with two strategies. You can order patient-specific doses for delivery through specialty pharmacies, or you can set up your practice with your own stock of doses via a so-called buy and bill strategy. If you're having trouble locating your nearest specialty pharmacy, just call up your nearest local pharmacy and they can help get you on track. Once identified, you'll want to put this specialty pharmacy on speed dial so you or your team member can readily contact them through a provider line. Having done that, you simply place an electronic order to your pharmacy, submit a PA if required, and then a member of your team simply calls the pharmacy once a week or so to request delivery of all of the anticipated injectable medications for the week. Buy and bill is considerably more complex, though it has the advantage that you can administer XR-Bup on the fly, so to speak. That is, since you have your own stock of medication in your office, you can administer it ad hoc to any patient who you think is ready to receive it. The drawback really is all the requirements to maintain an inventory of multiple doses of XR-Bup in your practice. Financial risk inherent to buying these very pricey medications up front, and the complexities of billing various insurers when a medication is administered to your patient. For larger practices, this significant administrative burden might be worth it, but for most smaller practices, it's probably better to use specialty pharmacies. Okay, having procured XR-Bup for your patient, let's talk briefly about storage. Sublocade needs to be refrigerated, and as a controlled substance, most policies require that this medication be, quote, double locked, meaning it must be stored in a locked fridge inside of a locked room. Brixadi, in contrast, doesn't need to be refrigerated, so doses can be stored in a locked cabinet inside of a locked room. Incidentally, the actual boxes of Sublocade and Brixadi are quite bulky, so you'll have to bear that in mind, all the storage space you would need either in your fridge or in your cabinets to accommodate all the doses of Brixadi or Sublocade that you would want if you're doing a buy and bill type approach. Okay, you go the specialty pharmacy route and order a dose of Sublocade 300 milligrams with a plan to administer it to Lara next week. In the interim, she continues taking sublingual buprenorphine films. Medication arrives a few days later. You store it in your double locked refrigerator, and Lara arrives on schedule for the injection. So how do we administer it? The actual injection of XR-Bup, particularly Sublocade, can be downright painful. It's 1.5 cc's of a very viscous substance administered subcutaneously via a 19-gauge needle. Brixadi doses are a bit more palatable, as even the highest dose, 128 milligrams, is only 0.36 cc's. It's less viscous, and you're using a 23-gauge needle as opposed to a 19-gauge needle. Regardless of which medication you administer, there are a number of strategies for mitigating the injection discomfort. These include using an anesthetic spray, such as ethyl chloride, an ice pack, or even more recently, I've been injecting a small aliquot of lidocaine immediately before the injection. Sublocade is administered sub-Q in either the abdomen, the fatty part of the triceps, the thighs, or the buttocks at an angle of 45 degrees. Brixadi can be administered in either the abdomen, the fatty part of the triceps, the thighs, or the buttocks at an angle of 90 degrees. Complications from Sublocade or Brixadi injections are rare, but it is important to caution patients that if they develop significant pain, increasing redness at the site where the injection was performed, they really should reach out to you ASAP, because this could be a harbinger of skin necrosis, as the injection was probably performed too superficially, and that may necessitate urgent surgical referral to actually excise the ball of medication, particularly with Sublocade. Lastly, after administering a dose, like any medication administered in the office, you'll need to document the injection or MAR it within the medical record. Lara is grateful for her first dose of XR-Buprenorphine. You're just delighted that Lara will be safe from overdose for at least the next 4 to 6 weeks. And let's hope that with this new regimen, she also gets some degree of stability in her treatment. With that, we've covered the entire process, from patient selection, medication selection, acquisition, storage, billing, and administration. I think you're ready to get started with bringing XR-Bup into your practice workflow.